Hello, I'm Todd Robbins, owner of Robbins Rehabilitation, and you're getting this video because you've likely had a few visits of physical therapy, maybe a week, maybe a little bit more, and I just wanted to touch base with you and make sure that we're on the right track and that you understand kind of what to expect in this early stage of physical therapy. So at this point, if you've gotten in for a few sessions, you should be seeing some improvement. You may be seeing strength and range of motion improvement. Hopefully you're seeing some pain relief if you've had pain. Sometimes it takes a little bit longer, okay? Like every condition's a little bit different, but we should be seeing some improvements in physical therapy right now. And if you're not seeing improvements, talk to your physical therapist about it. Get more of a detailed explanation on your specific condition and why you may be having some aches and pains, or not seeing the progress that you want to. And another thing I want to know is there anything that we can do in this early part of physical therapy, early part of our relationship? It's important that we know that if there's any issues or problems, are you having trouble getting in for your appointments? Is there any other questions that you have or things that you don't understand? It's crucially important that you understand what our treatment plan is and what our plan is for getting you to successful discharge. That is very, very important. Are you doing your home exercise program? At this point, you should have gotten some exercises from your therapist, depending on what you're dealing with, to work on some of your issues at home as well as in therapy. It's really, really important that you are following up at home and working on some of these things that we're working on in treatment to help reinforce it outside the clinic. Are you coming to your visits as prescribed by your physical therapist? Now, I know it can be tough to get in for the amount of times that we require. Our patients that come in consistently, starting out in this early stage, are getting in 3 times a week, at least 2 times a week, get better faster, okay? We try and offer as many hours as we can to get you in. And we offer different payment plans. If there's any problems with your insurance, or the cost is very high, we do offer payment plans for that. But if for some reason you're not getting into physical therapy consistently, it's really, really hard for us to get where we want to go. Okay, it's so important that you're coming in for your appointments and following up at home. We want to give you the best chance that you have. So if your therapist prescribed you to come in for a certain amount of times per week, it's important that you're getting in that time per week. Otherwise, it can drag out treatment and make this condition last even longer. Are you drinking water and eating good food and doing some of the things that we talked about at your initial evaluation? We try and give you some different health tips outside of what we're doing in physical therapy that can help you get better. But most of my patients need to drink a little bit more water. That's one really important thing for inflammation and pain. So if we gave you some recommendations at the first visit about sleep, about nutrition, I want you to be following those. Do you understand your insurance? This is always an important thing. Now, we try our best to explain it to you, and we try and explain it multiple times. It's such a confusing thing. I never want you to be confused about what your coverage is for physical therapy. If you're not sure for some reason or it didn't make sense, let's get it cleared up. You can call our offices and talk to our insurance department, or you can talk to our aides at the front desk when you come in for your next appointment. I want to make sure that you understand everything that's involved in that. I also want to remind you, it's early on right now. You've just started. Keep an eye on the goal. Our goal is to get you successfully discharged. We're trying to get you back as close to 100% as we can get you and give you the tools that you need to keep it that way. That is our goal. That is our goal with every single patient that comes to Robbins Rehabilitation, and I am personally invested in that. It's very, very important to me. So remember, this is, you've been coming in for a week for a few visits. It might be a little tough right now. This is the hard part of physical therapy. If you can continue to be consistent and follow the exercises and advice that we give you and come in for your appointments with your physical therapist, you are going to get better. It's just proven like over time. We're a very long time here at Robbins Rehabilitation. If you can do what we ask you to do and make those appointments, you're going to get better. Thank you very much. I hope the initial part of your physical therapy at Robbins Rehabilitation is going well. As always, if there's anything that you need help with, or any issues that you're having, please contact me directly. I'm happy to talk to you and resolve any issues that you have, so that we are, again, getting to our goal of a successful discharge for you and get you back to life and doing all the things that you want to do.